The two main categories of lymphoma are Hodgkin lymphoma and non-Hodgkin lymphoma. Non-Hodgkin lymphoma is a large group of diseases with different symptoms, treatments, and outcomes. The appropriate name of the type of non-Hodgkin lymphoma may include a number of descriptive terms that can be difficult to understand. Lymphomas arise from lymphocytes, a type of white blood cell, which are of two types, T cells and B cells. Both help in killing infectious agents, however, in slightly different ways. Based on the type of lymphocyte turned into the cancer cell, the patients may have a T cell or a B cell lymphoma. B cell non-Hodgkin lymphoma is the more common type. There are many different types of B cell and T cell lymphomas, each behaving in a different way. Pathologists performing biopsy of the tumor define the cancers in terms of grade. High-grade lymphoma cells look quite different from normal cells. They tend to grow aggressively. Low-grade lymphomas have cells that look much more similar to normal cells and multiply gradually. Intermediate-grade lymphomas fall somewhere in the middle. The behavior of these types is also described as indolent and aggressive. What the pathologist describes as a high-grade or intermediate-grade lymphoma usually grows fast in the body, so these two types are considered aggressive non-Hodgkin lymphoma. Surprisingly, aggressive non-Hodgkin lymphoma often responds better to treatment, and many people with aggressive non-Hodgkin lymphoma are cured if they are diagnosed early. The most common kind of aggressive lymphoma is diffuse large B-cell lymphoma. On the other hand, low-grade non-Hodgkin lymphoma grows gradually, and these lymphomas are therefore called indolent non-Hodgkin lymphoma. This group of non-Hodgkin lymphoma doesn't give rise to too many symptoms, but they are also long-standing and are less likely to be cured. The most common kind of indolent lymphoma is follicular lymphoma. At times, indolent lymphomas can transform into more aggressive. The majority of lymphomas are nodal lymphomas. That means they originate in the lymph nodes. However, it is possible for lymphomas to arise from anywhere else. When the lymphoma is mainly present in nodes, it is called nodal disease. Occasionally, most of the lymphoma may be in an organ that is not a part of the lymph system, such as the skin, the stomach, or the brain. In such condition, the lymphoma is referred to as extranodal. Therefore, nodal and extranodal refer to the primary site of the disease. A lymphoma can develop in a lymph node and then involve other parts at a later stage. However, in such a case, it is still considered a nodal lymphoma, but is said to have extranodal involvement. In follicular lymphoma, the cancer cells arrange themselves in spherical clusters called follicles. In diffuse non-Hodgkin lymphoma, the cells are spread around without any clustering. Most of the time, low-grade non-Hodgkin lymphoma looks follicular, and intermediate or high-grade non-Hodgkin lymphoma looks diffuse in biopsy. Non-Hodgkin lymphomas are also described as common or rarer based on the statistics of the new cases every year.